Okay, Harriet. Today I'm talking to Harriet Smith from the Nottingham Biomedical Research Centre.
That's right, yeah.
Oh, I spelled it right. And we are on a conference in Regensburg about tinnitus. And Harriet is investigating a very interesting field that I, to be honest, never thought about. Is there also tinnitus in children? Harriet, can you tell us a little bit about your work and what you find out recently? The first question that comes to my mind is how many children are experiencing tinnitus and what is the age we talk about?
Sure, so not a lot of research has been done with regards to tinnitus in children, whereas the prevalence of tinnitus in adults is quite well known. There have been a few studies in children, but the exact prevalence is still to be discovered. So a recent study told us that in a typical class of 30 students, around one child will experience bothersome tinnitus.
Bothersome, okay.
So that's tinnitus that affects their everyday life and well-being.
Wow, that's a lot. I imagine a school class or maybe a kindergarten class and they have 30 children and one of these has bothersome tinnitus. When you say bothersome, what I can imagine is that there's a high rate of children who have tinnitus but don't know it because they think it's normal. That's
what we think. So very much like an adult population, there are probably more children that experience tinnitus that don't find it bothersome or don't realise that it's not normal to experience.
Okay, and do you also examine how these children got their tinnitus? What are the reasons why they have tinnitus in such young years?
There has been some work with regards to risk factors, but like I say, the work is very limited. I will be looking at the problems that these children are experiencing, so less so about what caused their tinnitus, but I'm more concerned with what are the issues that they are facing, why is tinnitus a problem for them.
And how do you find these children?
So I'm working in the UK, in Nottingham, and we are connected to several specialists in this area, specialist clinicians who see children with tinnitus. So I hope to recruit through these specialist centres.
Okay. I'm sure that a lot of parents will watch this and maybe they have tinnitus themselves and think, oh no, I don't want my child to have tinnitus. First, I have two questions on this field. First question, would it make sense to ask a child, do you hear a ringing or something in the ears when it is silent? To find out if the child already has tinnitus, or would you think, no, if the child has tinnitus and it is not bothered, maybe it will get bothered if it knows that there's something that's not right?
Sure, and that's an ongoing discussion that's going on in the research world and the clinical world as well. So recently, I'll talk first of all to the clinical approach to that. The British Society of Audiology, in their guidance for tinnitus in children, recommend that in a paediatric audiology appointment, that the audiologist, for example, does ask the child, as part of the history, do you hear noises in your ears or heads? I guess the belief of these clinicians is that if the child doesn't experience tinnitus, they will say no, of course. And if they do, they may say yes, and that is the opportunity then to intervene if needed. But it's very much up to the skills of the clinician not to cause unnecessary distress.
Yes.
And I think that's quite possible in a child that they will just kind of take that very logically and handle that in a normal way because it is quite a straightforward question.
Yeah.
So I'm not sure on the best recommendation for a parent because a child won't spontaneously maybe report their symptoms to their parent, but there may be other indicators to the parent that the child is struggling with something, and if it does seem to be a problem with their hearing, they might want to ask their child a little bit more about that.
Because I remember one case at the school of my sister. There was a girl who was behaving very strange and had a lot of problems, and after years it came out that she had chronic pain. So she felt pain all the time, but didn't know that this is not usual, but her behavior was not like in a child that had no pain. And I think maybe something similar can be the case with tinnitus. If it's severe, you have a loud noise maybe, and you don't know that this is not silence, maybe you get a bit stressed.
I think that there is a possibility there. So obviously questioning a child about tinnitus needs to be handled sensitively,
Definitely.
but it's also important that we don't miss the opportunity to pick up tinnitus if it is there and if it is causing a problem.
Yeah, and the second question, I mentioned two questions. The second question is, what would you recommend parents to preserve children from getting tinnitus? I mean, first thing I think about is noise exposure, because you go to a concert or something, or loud things that happen on the street. Maybe this is a danger even for a kid.
Absolutely, yeah. So ear protection in noisy environments at gigs and festivals and things like that is definitely something to be aware of, because that is one of the potential factors that might cause tinnitus in children, amongst other risk factors.
Yeah. Okay. And now we come to an end, and with one last question. I think it's not quite clear what is the age in which children already can have tinnitus. Can you say from till?
Anecdotally, the clinicians that I work with have seen children report tinnitus as young as 3 years old.
Wow.
So from as young as that.
Yeah. Thank you, Harriet. I hope that you can change the situation that not much is known about tinnitus in children, and your work is very important. Keep on pushing forward, and maybe one day on one conference you can tell the other tinnitus experts what to do and with children. Thank you.
Thank you.